Welcome to our SBAH radio listeners and viewers. This is Vuyo Vuniweyo. I'm your host for today's episode. Well, as we all know that according to Health National Calendar, on the 17th of April, we'll be hosting Haemophilia National Day. Today, I'm visited by our special guest from the Department of Hematology, all the way from Steve Biko Academic Hospital. Dr. Ngabi, how are you doing today?
I'm fine, thank you. How are you?
Okay. Can you please tell us, to someone who's listening out there, what is hemophilia, what causes hemophilia, and how are you going to be celebrating it as a hospital?
Okay, I think before I explain hemophilia, let me just explain basic concepts of how blood happens and how people end up bleeding. So hemophilia is a bleeding disorder that is often seen in male patients more than in female patients. And but the basics of what happens is that in your body you have what we call veins and arteries. These are pipes that pump blood to and from your heart. There's big pipes and there's small pipes. So veins and arteries are usually the big ones, and then you have the smaller ones that carry blood. Those are usually the capillaries. So most people, when they have a bleed, it's bleeding that usually starts in the capillary, the smaller pipes that are in your body. And the body has mechanism to stop you from bleeding once you injure your capillaries. And what would happen is that you have what we call platelets. Platelets, they come and they form something like a plug whenever you injure your capillaries so that you don't bleed forever. But the platelets are not enough for you to bleed, to stop the bleeding completely. Then the body has things that we call factors. These are called clotting factors. These clotting factors help the platelet make a good plug so that your capillary doesn't bleed continuously and for a long time. So with patients that have hemophilia, they usually do not have certain factors that make the capillary and the plug that has formed be a strong one. So you'll find that they injure themselves, they bump into a table, or they hurt themselves in any way, they cut themselves, however they get the injury. The capillary starts to bleed, they may have good platelets, but then the bleeding will continue because in order for that plug to be nice and strong, you need factors to come into that place. And we have two kind of factors that are very important in hemophilia. It's factor 9 and factor 8. And those, depending on which you are deficient in, whether you are deficient in factor 9, you will have hemophilia B, or deficient in factor 8, you will have what we call hemophilia A. So you'll find that most of our patients who have hemophilia are deficient in one of the two factors. And therefore we can grade it into different grades, very severe, mild or moderate. So depending on how severe, which kind it is, A or B, depending on the type of factor that you have, how severe or how deficient you are in the factor, then we will classify you as having a hemophilia. And usually it is passed, it is carried, the hemophilia gene is carried on your X chromosome. X chromosomes are usually carried, are usually on your sex chromosome. Genes are things that carry messages to your body. Everybody has got different genes. Your genes determine what color your hair is, what color your skin is, what kind of, just genetically how you will be.
Yes.
So in patients who have hemophilia, they have a defect in the X chromosome, which is carried mainly by the female patients. And what you will see is that if the normal female will have X and X chromosome, and the male will have X and Y chromosome, right? If a defect is on the X chromosome, the female patient can be safe because they can have X, another X that's working, and an X that is not working, that carries the defect in the hemophilia, that carries the hemophilia gene, a defected one, and therefore they will be called a carrier. But a guy is usually XY, and if you are XY, you only have one X, and if you inherited a defected X from your mom, it means you will have hemophilia disease. And therefore, two people, whenever a woman is pregnant, she can have two kind of kids with hemophilia. One who is a carrier, and it's usually the girls because they will have a proper X and an X that's affected, or a boy who will have only a defected X. And if you have a defected X, then you will have hemophilia. So it's a disease that's mainly seen in males or in men more than in females. Females are just carriers of it, and males are usually the ones who have the disease of hemophilia.
Okay, now I understand you're saying that the X chromosomes are, since the males are X and Y, and they are the ones that who are more likely to be affected by the kind of this disease. The reason of this is because of the single gene that is in the male.
Well, that's on the X chromosome. It can be in the female, but it's on the X chromosome. Man doesn't have an alternative X. You just have one X.
Yeah.
Female has X and X. And therefore, if you have a good X from your mom, or then you have a bad X from the affected X from your other parent, then you'll just be a carrier. You won't have hemophilia disease. You're a carrier of hemophilia. But a male only has one X. And therefore, if you have that X that's defective, then you will have the disease because you don't have an alternative.
Okay, so looking at the stats of what you've said to us, that you're saying that males are the ones who are likely to get affected. So for them to get support, how is it for them to receive the support on the treatment side?
Okay, so let me start by saying, well, usually hemophilia, the kids will usually present. Well, you are born with it, right? So if you are born with it from infancy, when you are a baby, newborn baby, we usually don't see much in them unless we have a circumcision. And then during the circumcision, we may experience bleeding that the patient may have. And then we'll know there's something wrong from the circumcision, minor cut. Why is the baby bleeding? But usually we don't know that the baby has, if the mom doesn't know she's a carrier, right? And therefore, what will happen is that as the baby begins to crawl and starts walking, and becoming mobile, then they may start to have bruising. Remember, your capillaries are injured now. Once you start bumping into furniture, you're crawling, you're hurting, you're falling, then you'll see that these babies are starting to have bruising more than the average child. And sometimes they can even have bleeding from the mucosal membranes, like from the inside of their mouth or their lips. Those are the early signs that we can suspect that hemophilia may be present in the patient. But now, as the patient gets older, depending on the severity of the hemophilia, then we can start to see even greater symptoms where they will start to bleed significantly into important bodily structures, not just mouth bleedings, not just bruising. They can also start to have bleeding into their joints. And the main joints that are affected is usually the ankle, the knee, and the elbow joints that are usually seen. So you'll have, most of the time, you'll have these kids presenting to our clinics, and somebody would think, oh, it's arthritis, the knee was swollen and big, and it's getting bigger, and we're not sure what's happening, and we usually think it's infection, and we start running the infection route, only to take them to an operation and discover that they're bleeding and bleeding and bleeding. And when we do the test, that's when we will discover that actually this patient has got hemophilia. So it's usually, if the parents don't have the history that I have a hemophilia, we usually diagnose it a little bit later than we could have expected for most of our patients. But if they know, we usually are able to diagnose it much earlier.
And that's all from me. Dr. Ngabe, any last words before we close the show, since we know that you'll be hosting an event on the 17th of April?
Well, we are on the 17th, we are having our World Hemophilia Day, and it's very, very important that we bring awareness to it. For a long time we have thought of hemophilia as being mainly a men's disease, but there is a significant amount of ladies who are affected, who are carriers, and carriers also carry a significant risk to them because, one, they can have abnormal bleeding while they're female, they can also have increased injuries, bleeding during injuries, but it's not to the severity that we see in the male. They may also be at risk of having postpartum bleeding, that means bleeding after they have babies. And the last thing is that during pregnancy, if they're carrying a boy and they're not aware of their carrier status, they are at risk of giving a birth to a child who may be injured during the birth process, where they through whatever procedure that we're doing during the birth process, that the baby can be injured with whatever procedures and they can bleed without anybody knowing. So although it is a male disease, most of the time we make awareness of it. I think it's very important that in this year that we acknowledge that it can also affect some women, and it's very important that we acknowledge carriers of hemophilia in the females, as they are also affected, although not to the same degree as male. And therefore, I hope there's greater awareness about it everywhere else.
Well, thank you for coming, Dr. Ngabe. That's all from us. It was a very wonderful episode listening to an educational and raising awareness about hemophilia. Yes, if you had all other mentioned symptoms about hemophilia, please visit your nearest clinic and hospitals. Thank you again for watching this episode. Please follow us for more health content on SBAH Radio and Facebook pages. Thank you.